Good morning, everyone. My name is Dora Niedersuspeke. I'm a medical oncologist from Austria, Vienna, and I'm happy to join this session with my co-moderator, Dan George, from the Duke University Medical Center. And I would like to invite Laurence Albiges first to give us a short talk about the KCA updates. Welcome, Laurence.
Thank you, Dora. Good morning, everyone. I hope you had a lovely evening here in this beautiful town. So my name is Laurence Albiges. I'm a medical oncologist working at Gustave Roussy Institute in France. And I have the chance to sit at the board of the KCA. So what I would like to do is to give you some update of what the KCA means for all of us in the room, for our patients, and also brainstorm together on what would be the next steps. So just to give you a hint of where KCA has landed in Europe throughout the past years, from Madrid, the very first meeting, up to this year in Edinburgh. Only one meeting had to be canceled because right at the middle of the beginning of the first wave, the pandemic, and one had to be virtual. Otherwise, all of them were in person, and I can tell that I'm very excited. I could see a full room yesterday when we started the meeting. So you can see that we've been through major cities all across Europe, and we also explore new territories in some way. And I hope that many of you could actually come to several of these meetings and look forward to see you in the future ones. What I would like to highlight is how this meeting is international. It is international, and it has an amazing program. I'm not involved in the program, so here I would like to thank the planning committee because they did an amazing job with the agenda, mixing our educational session with the oral abstract session. I think this is very interesting because that gives opportunity to junior faculty to present their work. As you've seen, we now have a great number of posters that are being presented. And please, for those of you that have not yet done so, please go and engage discussion with any faculty presenting their posters. And we had this year a think tank ahead of the meeting to try to, once again, develop the KCA in a way that would be useful for all of you in the room and for our patient. This year was initiated a Young Investigator Session. This is something that will still need to be fine-tuned, but we believe there is room here for more mentoring of our junior faculty. You've noticed yesterday, the room was very excited to have a woman in RCC session. I think over the past 2 years, and thanks to Gretchen, we've come from what is the situation to what are the actions we want to trigger. And this is something that is done within the KCA, but as you may know, also outside of the KCA, among your institutions or your countries at the national level. And we really feel that KCA can actually help in this regard, and we're getting now to the, let's say, action items of what we would like to build together. You also notice that we have networking opportunities throughout the meeting, and at the end of today, within one of our highlight sessions is the wood fire, and we all look forward to this session that is very dear to our heart. You have heard lecture, we'll hear soon from another award. This meeting is the opportunity to shed some light on rising stars within our field, people that we are eager to see develop the field and push forward the treatment for RCC for all our patients. Pay attention to the attendees. Of course, we have a large number of medical oncologists, but we are very happy to see so many diverse specialties attending the meeting to the right on your slide. One thing that is very important, and I'm sorry because I feel the junior faculty or maybe the fellows went out very late in the evening, so they may not be in the room, so please take notes for them, is the grant process. I asked the KCA to put the grant process on these slides because sometimes it's difficult to remember the dates. But please mark your calendar, because there are funding opportunities that usually are posted on the January-February months. Then the application is due in April, and then the recipient is announced in summer. And these are great grants for PhD students, but also for postdoc. So please pay attention to these grant cycles, because we believe this is helping the field to move forward. And KCA has funded millions of dollars. And as you can see, this has been dedicated to RCC, of course. One thing that I would like to stress is on the right side of the slide. For the first time this year, the KCA has created funding opportunities with other foundations and associations, focusing on rare RCC subtypes. And this is an unmet need. All of us know that. Patient advocacy group knows that very well because patients are in need for us to move the field forward for those rare entities. So this is an opportunity to, here again, build the knowledge, the biology, and ultimately the therapeutic for those. I'd like to stress as well that the KCA funding is not dedicated to the US, and we have international funding that are with some of the recipients highlighted here on this slide. Please advise that to all your fellows. They are more than welcome to apply to these grants. One word on patient materials. KCA has developed a lot of materials for the patient, and many of them are actually useful for your patient, irrespective of the country you're from. It could be virtual patient symposium. This is something that people really enjoy in terms of patient, and they can attend because it will be recorded and available in replay. There's a great patient video library with a lot of educational videos. I always tell to my patient, you have this. We have a French association in France named Arthur. I gave them the French association link, and I gave them the KCA link. And many of them are fluent enough to check online and learn more because they have, of course, more materials on the KCA websites. There are other activities that you can read on this slide. I won't list them, all of them, but I really feel that you could take a look yourself and figure out, because many of these items can actually be helpful in your clinic to help your patient navigate the disease. Ultimately, KCA is here to help all of you, meaning physicians, researchers. Both Professor Tom Pauls and myself are heavily involved in KCA, and we would love to hear more. Feel free to reach out to the KCA staff or to us if you want to have any idea or build things together within Europe. So what we would like to do now is take a little survey. So we have only 3 questions. It's going to be fast. First, we need you to connect to this QR code. So I would like to see the phones up, please. Whenever everyone is ready, I'm going to switch to the next slide. All good? Phones up. So the one is just for us to make sure that you are, if you want me to go back to previous slides, where do you live? Okay, perfect. So Europe, the US are very well represented. Maybe you're faster on your phone. Okay, great representation. We could zoom in a bit next time. Okay, I'm gonna move to the next slide, next question. So, what are the largest gaps for your institution and country? Please think at the level of your institution and country. Next question will be for you. Is it patient symposium and a community? Is it education for patient? Is it clinical trial? Is it CME for physicians? Is it a clinic network within Europe? Research grant, mentorship, and advocacy to the government, especially for drug reimbursement. So, winner is clinical trial, followed closely by patient education and symposium for patients, as well as research grant activities. This is very important, and advocacy. Thank you very much. This is very helpful to have this view. Next slide is for you, as a physician or researchers. How can the KCA best serve you? And I'm very happy you spotted grant, because that's my usually first answer to the KCA. So thank you. So grant CME, wow, it's fast to vote, but it's okay. So first one is grant, second is CME, continuing education opportunities, as we're doing during this meeting, building the network, and also opportunity to network with pharma. Many of them are in the room. These meetings are very important for us. It gives us the opportunity to connect with you and build the next program together. So this one you will have to write. It's to help KCA to figure out who they should connect with to collaborate in your country. It could be patient advocacy group, and you can name them. It could be institution. It could be academic consortium. This is something that is important. So here, Kidney Cancer UK, thank you very much. BCAN, Euronoten. So we're going through the different either national groups, but also academic and patient advocacy group. So that was fast. I'm sure people are still filling in. So the KCA will have all the notes. And I think it is very important that you feed us with all this information so that the KCA once again reinforce what we're able to provide for you and for our patient. Without further ado, I would like to thank you, and I'm pleased to hand over to our chair. Thank you very much.